obstructive sleep apnea is a disease that, as a society, we're becoming more and more aware of, and largely driven by industry of the driving industry. And the research began as people were starting to fall asleep at the wheel, or were having accidents, and we started finding out that, the human body actually needs a certain amount of sleep. Well, as that research progressed, we found that although people were laying down for 8 hours, they weren't really getting 8 hours of good quality sleep, and then it became a mission to figure out why. We know today that in many instances, people have a condition called obstructive sleep apnea, and in which, as the body relaxes and we start to go to sleep, the airway tends to close off, and we don't breathe. It particularly happens just as a person is headed into REM, which is the most important time of sleep for healing and cognitive abilities. Right as a person starts to go into that, the body relaxes and goes into a catatonic state. And as the body does that, then the airway tends to close off. The muscles relax around the airway, and in a very real way, the individual begins to suffocate, lose air. Well, the body doesn't like that and reacts by waking us up just enough to get a nice breath until we finally get to relax and go back to sleep, and then it happens again. There's an index we follow and can be recorded through sleep studies that show how many times an individual actually stops breathing or has low airflow or oxygen flow during sleep. And all the studies in the recent 5 to 10 years now show how important that is on one's cognitive ability and ability to handle stress. It's interestingly been linked to a lot of childhood diseases. There's a great study done in China with a large group of children who were diagnosed with ADD or ADHD. And once examined and their airway problems solved, a huge percentage, upwards of 95 to 98% of those children, the diagnosis was dropped. They were dropped from all medications and were no longer considered ADD or ADHD. And it was found that those behavioral problems were driven by a lack of oxygen to sleep. And in most instances, it was overgrown tonsils or adenoids. In the adult population, what we find is that anatomical changes that happen as we age or just go through life tend to close the airway significantly. Another thing that happens is that as we age, we don't respond well to a lack of sleep, and so often these symptoms start to manifest as early as people's 20s and 30s, depending on the condition. And the condition is a blockage of the airway due to an obstruction of some sort, causing us to have a lack of air. So traditionally, or initially, the first line of thought from the medical community was, wow, if they're not getting air, we're going to force air through them. And that's what started the process of a CPAP, or BiPAP now, but it's a process of forcing air past the obstruction. Well, in recent years, the American Medical Association has come out and said that the first line and preferred method of treating mild to moderate sleep apnea is actually a dental device. Why is that? And as you think about it anatomically, it's very clear. Most of the blockage happens right in the back of the throat, where the tongue wraps down near the tonsils of the throat. When we relax, we put our head back, our jaw drops back and relax when we're sleeping, particularly on our back, all of that anatomy, our tongue, our cheeks, the sides of our throat, tend to sag back towards the back of the throat, thus blocking the airway. That is the leading cause of sleep apnea, is the tongue and the tissues surrounding the front of the throat. So, a dental appliance that is made, a dental sleep apnea appliance, actually holds the jaw forward, the lower jaw forward as we sleep, allowing us to relax without it dropping back and without it blocking the airway. As I experienced that and went through that process myself, I realized the benefits of treating it. As such, we've taken the time in our office to go and we've actually credentialed with your medical insurances so we can provide this service with the least amount out of pocket to our patients and be able to provide solutions for their sleep problems. And that's something we're really excited about, to be able to provide that for our patients.